Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about glucose tolerance test. It is otherwise known as GTT. This is a tolerance test in clinical or lab test used to diagnose diabetes mellitus in doubtful cases. When there is any patient who has the symptoms or any doubtful cases, this glucose tolerance test are provided to confirm the patient is diabetic or not. Indications for GTT. What are the indications? Should be for in the GTT. The patient has the symptoms of diabetes mellitus. When the patient has the symptoms of diabetes mellitus, this test can be done, a glucose tolerance test. Inconvulsive fasting blood sugar level. For only by seeing the fasting blood sugar level as well as the random blood sugar level, we can't confirm that the patient is diabetes mellitus. So this glucose tolerance test is also used to confirm that as a diabetic people. Excessive weight gain during pregnancy. Generally during pregnancy there might be a weight gain. So we can't say that every person in the pregnancy have diabetes, gestational diabetes. So to confirm that, we can give a glucose tolerance test to the people and we can confirm whether she or he has a diabetic or not. Contraindications. Not to be confirmed diabetes mellitus in the patient. Not to be done in the terminally ill patient. Contraindication. This glucose tolerance test should not be done to the confirmed diabetes mellitus patient. When the patient is confirmed that he is diabetic, he or she is diabetic, we should not do this test, as well as we should not do this test to the terminally ill patient. Preparation of the patient. What are the steps should be followed by the patient before going this glucose tolerance test? The patient is instructed to have good carbohydrate diet for 3 days prior to the test. For 3 days, the patient is said to have a good carbohydrate diet for 3 days. Avoid the drug like influence the blood glucose level. We should avoid the drug which disturbs the blood glucose and alters the blood glucose level. Avoid the drugs like influence the blood glucose level. 12 hours of fasting should be maintained. Then there should be 12 hours of the fasting before the day of the test. No smoking and exercise should be done. Procedure. Now, what is the procedure of this glucose tolerance test? The procedure is GTT. The glucose tolerance test is conducted in morning. The fasting blood and the urine sample is collected. As soon as the patient arrives, the fasting as well as because lastly he will be 12 hours of fasting should be maintained before taking this glucose tolerance test. As soon as the patient comes to the clinic, there should be a collection of the blood and urine sample of the fasting blood and urine sample, and we gave 75 gram of glucose in 200 ml of H2 water. We add 75 gram of glucose into the water and say the patient to drink orally. Then the blood and urine sample is collected for 30 minutes of interval for 2 hours. Then the patient blood as well as urine sample are collected for 30 minutes for 2 hours in the interval of 30 minutes. So here totally there are 4 samples as well as the fasting blood sugar as well as urine sample is collected. Totally 5 samples are collected. The glucose level is maintained both in blood as well as in urine. And this is the graph of this glucose tolerance test. This will be the normal, and this is the confirmed diabetics, and it is an impaired glucose tolerance test. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want any other topic, please do suggest in the comment box. Thank you.